Hello. Welcome back and happy Wednesday. We are um, living well the ultimate health journey with Jovi Marie, Dr. Philip Zini, and Alice Boswell, and myself, Angel Conway. And we're here to bring you another discussion on health and wellness. Today, we will be discussing weight loss and injections. So, we're not going to keep you waiting. Let's jump on into this amazing discussion. Dr. Philip, take it away.
So buckle up. This is going to be a bumpy ride and a little bit quick, and I may ruffle some feathers, so I'll apologize in the time. Uh, so this is primarily about all the injectable weight loss drugs that are out there. I won't mention them by name, but you understand what they are, the brands. And there's a big class called GLP-1 inhibitors. So we're going to step back a little bit and talk about what GLP-1 is. It's a naturally occurring hormone in the intestinal tract that helps with making you feel kind of full. It's triggered by food. It may help to reduce insulin sensitivity, which means that it may allow insulin to work a little bit better. So the important thing is that the drugs that are out there, and the generic is called semaglutide, is just that. It's a mimicker. In other words, it tries to do what your body is supposed to do, which automatically should be kind of a red flag because your body can do pretty well by itself. It doesn't really need that much help. When you look at some of the costs of these, it can be anywhere from about $10,000 to about $17,000 a year, based on copay, depending on what your insurance is, depending on what the condition is that's being treated. So it can be kind of expensive, and it can be not only just for weight loss, but it can also be for diabetes. So what's the good news? What's the hype out there? The hype is that you should be reducing anywhere from as low as a half a pound, which doesn't seem like it's a real good loss, to as much as 44 pounds, and that's in about a year and a half. So if you think about that, when a person does natural kind of lifestyle change, diet changes, the average person reduces about a pound a week. So if you look at the best one out there and it's 44 pounds in a year and a half, that's about the same as lifestyle. So what my colleague has put together, which is everything that I'm presenting, is her kind of own personal experience. She's a certified holistic nutrition coach. And in her 10 years of coaching, she's been able to achieve much better results. So when people say, I want the drug, she can tell them, there's probably not that big of a change that you're going to see. But more importantly, what are the side effects? And that's the big thing, is side effects. So the big one is usually GI issues, which means nauseousness, vomiting. The bad GI issues are pancreatitis. Now, you have to think about what is naturally occurring in the environment today. And there is an increased risk of pancreatitis when you get the COVID vaccinations. And the more COVID vaccinations you have, the more increased risk you have of pancreatitis or even pancreatic cancer. So now you've got that underlying risk, and you're going to have potentially a risk with some of these weight loss injectable drugs. The other kind of bad thing is anxiety, depression, and suicidal ideation. So that's not so good. So those are the kind of potential um, side effects that people may see with these. So as for me, I would want something that's kind of natural, and something that's going to be working better for me. The one that usually gets women, um, sorry, guys just aren't as vain, uh, but women like the way their skin looks. So sometimes you get kind of this hollowed out look because maybe some of the subcutaneous fat is being affected, or the collagen or the elasticity of skin is kind of different. So you have what's called the, I won't mention it, but the name brand injectable base. You can just Google it out there and you'll find out which one it is. But it's not an attractive look. So you look kind of sunken and shallow and um, like you're not really that healthy. So you want to be healthy. Um, so those are all the kind of the side effects, the potential risks. And then you have to ask, as a class, how well does it work? So as a class, there's probably around 15% of individuals that it won't work. I just saw a patient last week that had been on one of them for a year and didn't lose any weight. Why? Because their physician didn't say, plus you have to do diet and lifestyle. They just thought they could eat their way through. And again, this is what my colleague Denise always talks to people about is it's diet, lifestyle, and this kind of like maybe a little bit of a jump start to kind of get you started. Um, so that's one aspect of why things don't work. The other is because 30% of people stop it because of the nauseousness and they just don't want that. And the other side effects that we talked about. So, what are some of the natural things that you can do? So, at that point, I'll kind of stop um, and then we can take some questions. Yeah. So, does eating for your blood type help with weight loss? Interesting that you brought that up. Um, I'm not really a big fan of kind of fad things, but there seems to be something to this. And I think it has to do with your genetic type. So some people are more genetically predispositioned to more of a kind of a carnivore diet. And I'll be the first one to admit I don't know which blood type is which type of diet, but if you want to invest the money in eating for your blood type, it'll kind of tell you what you probably already know. For example, I'm Italian. My wife is Hispanic, so we grew up on, well, not we, she grew up on rice, beans, and tortillas. I grew up in pasta and garlic bread. And we just kind of automatically figured out that that's not really the best diet for us. We have different types of blood type, but we do better with more of a ketogenic diet. And I think that's what the Eat Right for Your Blood Type kind of tells you is what diet is going to be best for you. So, and there's also blood tests and different functional tests like a hair test analysis that can tell you what is going to be the best diet for you. Stacy asks, what should you discuss with your healthcare provider before starting injectable weight loss treatments? Um, Run away, maybe? Sorry. Uh, so you want to be frank and say, so tell me straight up, what are the risks? And based on my health, based on my background that you know about me, what are the risks of this medication? What are the likelihood that it's going to help? And then more importantly, what's going to happen when I stop the medication? And that's what we'll talk about next. So hopefully that answers that question. Any other questions? So, what happens when you stop? Again, most people, not all, but most people will end up gaining the weight back, especially if they do not do the hard diet and lifestyle changes. Um, so, which is a good lead into the next question: who's a good candidate? A good candidate is someone that is relatively healthy, and what I mean by that, they don't have a lot of comorbidities. In other words, they don't have hypertension, they don't have uncontrolled diabetes, they don't have high cholesterol. It's more of a sedentary type of lifestyle that led to the weight gain. Those people are probably a better candidate because by making the dietary lifestyle changes, they're probably going to have a better result. And when they make the transition off of the medication, they're probably going to keep the weight off. So you can transition with some natural supplements. Um, One of them is called a GLP-1 probiotic because what that does is it helps the gastrointestinal tract to naturally produce the GLP-1 that these drugs are trying to mimic. And it does this all naturally. The other thing that we've noticed is that people tend to have this underlying inflammatory either condition or response. So you want to try to dampen that. So there's a wonderful mangosteen product that we have that's called Xanthomist. And there's a wonderful glutathione product that we have that's an antioxidant because in the cell, thank you very much, Glutamist, in the cell, you want to start reproducing good, healthy cells. You want to help to reduce the free radicals, and you want to help the natural intestinal tract to work better. So that's kind of our dynamic duo. So by doing all of these things, then you can help to naturally keep the weight off. And not only that, but promote a healthier lifestyle. The other thing is that when you look at all of this, you can probably, if you wanted to avoid the injectables altogether, you're looking at maybe about um, 200 to $225 a month in supplements, which is a far cry less than your copay of $10 to $17,000, or in other words, about $1,000 to $1,200 a month. And when people are always asked, "What's the most important or what's the biggest investment you make?" They usually say a house, right? So a house payment or mortgage can be anywhere from 2 to 5 thousand a month. Then you ask them what their second one is. That's a car. A car could be anywhere from a couple, three, four, or maybe even 500 a month. So investing $200 a month on your health, that seems like it's a pretty good investment. Not to mention you're getting a good return on your investment because you're going to have a better quality of life for that investment that you're making. So if you can, it's always better to try to do things as naturally as you can. And then when you do things naturally, you're going to be naturally building up your metabolism. You're going to be naturally supporting a good, healthy, low inflammatory diet or low inflammatory health condition. You're going to be naturally reducing those free radicals. Um, and that's the antioxidant portion of the glutamist, the glutathione. So I think I'm almost out of time. So I'll stop there and see. So Alice has a question. Is it true that with any weight loss program, you are at risk to the weight returning? So again, when you do it pharmaceutically, when you do it kind of unnaturally, yes. Um, Even with lifestyle, you can get it back. However, if you have a good coach, and we have two great coaches in our midst, they can hold your hand and walk you through those rocky parts where you just don't feel like you can do it. You need someone to help to make those right choices or better choices. There's even apps out there where your coach can monitor you. You take a picture of what you're eating, and the coach can say, "That is fabulous." Or they may say, maybe next time make a little bit better choice on one of your items. So you can get hand in hand, tender, loving care, and you can be walked through. And that would be the best way to reduce the risk of the weight coming back. And the other thing, too, is that you get that positive feedback, right? So you reduce the weight a little bit and you see it coming off, and it's like, wow, I can do this. And then it's a little baby step. So you lose a pound or two, then you're saying, I can do this. Then it turns into, depending on how much weight you have to lose, 10 or 20. Or I've seen some people lose as much as 100 pounds. So it can all be done. Angel asks, where does water weight come from and how do you keep it off? So unfortunately, you ladies have this whole kind of weird hormone thing. I shouldn't say weird. Um, you got all these hormones that are working for you, sometimes working against you. So depending on where you're at in your cycle, sometimes you can get water retention. So when I do hormone balancing on some guests in my clinic, and they're coming in because they're low on estrogen, so I give them a good boost of estrogen to kind of put them back in that physiologic range, and they may have a temporary weight gain. So for them, usually a diuretic helps out. For some people that want to do it naturally, some green tea, that's a natural diuretic, you can do that. So that's usually where the weight gain comes from, is hormones not being well balanced. Um, it's not usually tied to something abnormal, although obviously if you have kidney disease or heart disease, you can have weight gain to that. But usually it's kind of a hormone imbalance. Good question.
So, Dr. Philip, I have a question. A young lady was asking that she was in some of those injections
Mhm.
to reduce, like, for diabetes.
Mhm.
So, but on the process of that, she said that she got really constipated. Why would she get that? And what would be more of a convenient way to go for her?
So again, remember when we talked about some of the GI side effects?
Hmm.
That could be part of it. Um, because if you're kind of nauseous, you don't really feel like eating, let alone drinking. So the first thing that I do for people that are having difficult times with bowel movements or constipating is up your water. Give your body as much water as it needs, because the whole idea of the colon, the large intestine, is to conserve and preserve water. So if you're not flooding the colon and kind of overloading it, if you will, then it's going to be harder to have a bowel movement. So you want to make sure that the colon doesn't think it needs to retain water in order to maintain metabolism processes. So that's why you want to kind of flood it, and you want to kind of drink the old adage. And I actually tried to look this up one time and I couldn't find a resource for it, but it just seems to be like one of those old medical myths. But it's half your body weight in ounces of water a day. So if you weigh 150 pounds, that means about 75 ounces of water a day. And unless, again, you have kidney problems or heart problems, you can't really have a problem with too much water. Sarah wants to know why she looks. Uh, I'm not quite sure how to interpret that question. Anyone else can help me out on how to interpret that question? No? So maybe, asking about why there's increased gas, I guess. So, so, so again, when there's GI issues, especially if there's intermittent constipation, then things will kind of back up and then suddenly released. So that's why it's always good to have as much water as you can tolerate so that you're having nice regular bowel movements. Certain types of vegetables or fruits can give you gas that may not smell the best. Sorry to be crude, um, but you can kind of figure out which things help or don't help that. The other thing is chlorophyll. You can get liquid chlorophyll from any pharmaceutical kind of nutrition store, and that's kind of a natural deodorizer too. Yeah, and sagging skin. Remember we talked about that brand name face? Yeah, it's the whole thing where your eyes are kind of sunken in. Um, the the subcutaneous fat kind of goes away. So as a result, there's going to be kind of a loss of elasticity. And so that's where the glutathione product, the Glutamist, helps out because again, the skin is one of the most rapidly reproducing cells in the body. Your body is producing about 3.3 million new cells every second. So if you can help reproduce good cells, that'll be beneficial. And that's all part of what we call the Vital for Life pack. So you have kind of four quadrants. The first quadrant is the antioxidant quadrant, and that's where Glutamist comes in. The second quadrant is the anti-inflammatory quadrant. That's where the Xanthomist comes in. It's an orange mist bottle. That's the one on my left, and that's the one that almost looks like a little fire extinguisher because it's going to help to put out the inflammation. Then the bottle on my left again, the Ultimate 7, that's going to work on the inside of the cell, and that's our cornerstone. We're making sure that the cells are getting all the nutrients that it needs. It's kind of your natural health insurance. And then the fourth quadrant is helping to boost the immune system, and that's the Super 7 because it has all the 7 superfruits. So that's kind of a good cornerstone foundation that if you're going to do anything, or if you're already taking some type of supplement, some people say the most expensive water in your house is the toilet water because what you're taking from some big box store, I won't mention brand names, but you kind of get the idea. It's not bioavailable, it's not being absorbed, and as a result, you're just urinating it out. So you're going to spend money. You want to spend money on something that's going to be bioavailable and something that your body can readily use. Will exercise help? Exercise always helps. And this is one of the things that Jovi and Angel always talk about in their coaching is exercise helps out with your blood pressure, with weight reduction, making you feel good. It helps to release good endorphins. It helps the joints move. It helps you sleep better. I mean, exercise is just an all-round good activity. And yes, Angel is correct. So again,
Dr. Philip, can you explain a little bit about the Glutamist?
So again, the reason why it's quadrant 1 is because it helps out on the inside of the cell. And that's the first thing we want to do. We want to fix the inside of the cell so that the cell can reproduce good, healthy copies, not bad copies. And the other reason is because it is one of the most potent antioxidants inside the cell. So it helps to reduce the free radicals that your body is bombarded with. It also helps out with, as we talked about before, skin elasticity. So that's why people's skin looks better, feels better, is smoother. It helps out with weight reduction because it's helping cells work better. It helps to detox because it's helping the liver work better. And again, in the environment that we live in, we need to detox everything that we breathe in, literally, and it helps the GI system work better. So, um, and then it just with mental clarity, brain health. Um, so again, by naturally helping out the cells, you're going to be virtually helping out every organ system in your body.
Absolutely. And that's amazing, Dr. Philip, especially everything that you're, the combination of it all, the
Mhm.
whole system behind it, because, our bodies do need those nutrients,
Mhm.
especially that, the foods are not as potent as they used to be. So we do need that little boost. And it's been helping a lot of people.
Yeah, you're exactly correct because, and they've shown, and there's books written on this about how the food industry, because of big agricultural farms, the same nutrients that were in foods back in the 20s and 30s aren't there now. So we need to have some type of supplemental insurance, if you will. And that's
Exactly.
why this Vital for Life foundational pack is that kind of supplemental insurance to make sure that you're giving the body everything it needs to try to work well, to try to repair itself, to try to heal itself.
Absolutely. So, is there any other questions that you have for Dr. Phillip? Because I know it's already a little bit of time, and he gave us a lot today. So, in overall, um, the Vital for Life. The Vital for Life is the one that we want for our overall health. Um, Also, always drink enough water. That's the main thing. Focus on having the right nutrients in your body at all times, and putting the water, the fresh water into your spring water, alkaline water, so at least you have plenty of water in your system. So I'm truly grateful for you, Dr. Phillip, as I always say, because you're always helping us out, helping all people that we know. So we are truly grateful for you for every step of the way that you do guide us, and always educate us. So I know Angel is off, and Alice, she's behind the scenes getting all of our questions for us. So you'll see us next Wednesday, living life, living well, the ultimate health journey with Dr. Philip Zini, Alice Boswell, Angel Conway, and myself, Jovi Marie. Any other questions that you might have for next week, have them ready, you guys, so we can get all these questions answered. And Dr. Philip has all the answers right now, especially for our health. So thank you, Dr. Philip. Do you want to end with anything else?
Um, I'm here to teach, to heal, and to serve. Thank you for listening in. Thank you for giving us your precious time, and we hope that this will help you live well on your journey in life. God bless.
Thank you. Thank you.